Well, I see that it's very difficult oftentimes for the men because when you go to the fertility clinic, their focus is so much on the women that men, when they have been given their sperm analysis, their parameters look normal and, the numbers look good, then it's almost like they get a little hall pass and then it's all on the women again. So either way, it's about optimizing. So yes, like let's look at that and see what we can do because it takes two to tango and sperm is 50% of the equation. Well, it's June. It's Men's Health Awareness. And, what gets missed, number one, is that we do focus on women. But two is that we forget about sperm, male and their sperm. And sperm is a great way to actually tell us and give us insight about the health of a person. So let's talk about some of the things. Well, actually, let's talk about this. In the past 50 years, sperm count has decreased by 50% or more. And there are so many things that we call sperm killers, and we're going to cover that today. And then we're also going to look at certain things that you can help yourself with. So shall we start? Do you want to start with that, Tanya?
Yeah, for sure. So I guess the biggest thing is to understand that before even knowing what could be affecting your sperm, is to actually get an analysis. So looking at getting a semen analysis, and I feel honestly, it should be part of a wellness screen, not just if you're going in for fertility struggles. 40% of fertility factors associated with men's sperm, so it's male factor issues. And we always look at women, like you're saying, but not just for fertility. What if we looked at men's health, like through their semen analysis as well as blood work, right? So even if it was like once every 2 years, because of what you're saying, it's a reflection of how healthy we are. So we're looking at volume and counts and motility and morphology. So volume, like the average would be about 1.5 mil as healthy. So looking at other factors as well as like hydration and fluid, like viscosity and such. But the counts, you want at least 40 million per mil. And then you would want to find that at least a third of the sperm that you're assessing are good swimmers. So that's like the whole assessment. And then if you can go one step further and do DNA fragmentation to kind of get a sense of, reactive oxygen species or like the oxidative stress that's impacting the sperm. So, go ahead.
Just in terms of what you said, absolutely. And they have to also look good. So morphologically, they need to be sound. So, it has one head, one tail that has a whip-like motion and a little body. And how we look at it is that it's basically a DNA that's packaged in a jet. So, and how the shape of it helps it get to where it needs to go to meet the egg. Because if it's misshapen, if it's not swimming appropriately, if there's not enough of them, they may not enter the egg. And it needs like at least 10,000 of them to surround the egg so that one of them can penetrate in. It's like teamwork.
Right. I feel like it's a sensitive topic for men to have their semen analyzed. And so it's important to note that I would say the majority, of the sperm, at least 60% are more often than not 2 heads and 2 tails. And that's normal. So like you're going to have a bunch of like junk, DNA and like semen, which is totally our sperm, totally normal. But what we're trying to do is like minimize that, right? Like, have enough healthy looking swimmers. And what can you do to reduce the oxidative stress? You can, number one, not smoke, which is such a big factor. The oxidative stress, it's the hardest hit, I would say, out of any other lifestyle factor. And the cool thing about men is they can quit for 3 months and have an impact on generating new healthy sperm, whereas with women, we're all born with our eggs. We, unfortunately, whatever we've done in our past can impact our eggs even to this day, like if we smoked historically. So, which is why anytime I see a woman in her 20s smoking, I'm always like, I don't think she knows. I'm always wanting to say something, but I'm like, be quiet, Tanya. You don't know them. Like you're walking down the street, you see a smoker, because it really can impact. And with men, it doesn't mean, okay, go ahead and, smoke because you can quit 3 months before conceiving. It just means that there's a little more forgiveness. And then alcohol is a big one. So alcohol does act as oxidative stress as well on the sperm, but it can also impact, just not just the sperm's function, but also sexual function. Like it can increase the risk for erectile dysfunction. It can increase estrogen, which, can reduce libido and then even if those factors aren't an issue, estrogen can reduce the quality of the sperm and testosterone can go down. So important to quit alcohol or limit it if you've been binge drinking to at least 1 to 2 drinks 1 to 2 times per week maximum. My general rule of thumb, I don't know what yours, Mary's, is, but if someone's doing like a big procedure like IVF and they're investing their finances into it, I usually say try to quit for the 3 months.
Well, I see that it's very difficult oftentimes for the men because when you go to the fertility clinic, their focus is so much on the women that men, when they have been given their sperm analysis, their parameters look normal and, the numbers look good, then it's almost like they get a little hall pass and then it's all on the women again. So either way, it's about optimizing. So yes, like let's look at that and see what we can do because it takes two to tango and sperm is 50% of the equation. And, when it comes to alcohol, maybe it doesn't even necessarily impact the physical sperm itself, but for some men, it does impact the in terms of actually, in the bedroom. So, and as we know, even when you're doing IVF, like there may be a decreased desire for man and woman just because it becomes so technical. But we say like it's really important to be more in sync and to connect, and sexual intercourse can be a great way to be able to connect. And if we're drinking more and then not able to perform, that just drives more stress into our lives, which is not helpful. So it can impact your sex life. It can impact your fertility directly or indirectly. So it's just a good way to like live your life by having less, if not stop for a little while. I think it's really difficult for men to completely stop though. What is your take on that?
I think it depends on how many drinks they're having, and it's really important to find out, the root cause of why they're drinking perhaps like 3 to 5 drinks a day. Sometimes, like if I had patients where they're in a lot of pain because they've had motor vehicle accidents, and so they're using it as a way to fall asleep because of pain. So then you're trying to find alternative strategies for pain management, as an example. Or they're just really high stress, and maybe the actual going through fertility is adding to their stress. So, with their wives and partners, and they're seeing, that is a way, like an escape, I guess you could say. So it can be easy if the intention is there and they realize the carrot is dangling, which is like having a baby, and it's really important to them. But you just got to support them because it's not like always that easy, right? And find out why.
And so then that's a segue to recreational drugs, because in Canada, it's now legal. So it's like just something to do to unwind and relax. And we say, and there's more and more evidence looking at the effect of on sperm. So I look at it this like if you get a little high, you get a little relaxed. So imagine your sperm's relaxed and it's not even swimming, it's just floating around, right? But that's not going to help them. And there's incidences where they say, it like loses its capacity to find an egg. So that's not so helpful, right?
Yeah, they get dizzy, literally, like, whoo, like, you're feeling high and so are your sperm. Like, and your sperm, like, I'll just say that too, like your sperm are getting drunk like you are, like, or tipsy or whatever, which is not ideal for fertilization, and can also tank testosterone, like reduce testosterone, which, men like to have testosterone. It makes them strong and sharp and not just helpful for sperm production and formation.
Well, and fun fact for those of you that do not know, sperm is the smallest cell in a man's body. So it's vulnerable. So let's go on.
I didn't know it was the smallest.
It's the smallest cell in a male's body. Absolutely.
Interesting. And eggs are the biggest.
It's the biggest in the woman's
female
cell. Yeah.
Oh,
it's completely the opposite. That's why we're so different. Women are complicated all the way down to the eggs.
I
Males,
think
it's
we're
just
both complicated and really, I think, it's not, we're just different and understanding each other. Oh my goodness,
all
so
right,
helpful.
fine. Okay, let's
Okay,
move
so
on. Let's
excess weight is another big one, which nobody wants to hear, because 2/3 of North Americans are, overweight, and a third are of that number obese. So, you walk in and you'd seem average compared to everybody else. And, but the belly weight gain is the worst because it increases inflammation. It can increase estrogen, reduce testosterone, and the actual, inflammation from the weight around the belly can like even heat up the area, which we want to keep sperm cool and testicles cooler. And then it can also just literally cause reactive oxygen species, an increase in those, and damage the sperm.
So, segue off of that, if you're contracting a virus and you actually get a fever, it can totally increase the body temperature, which it will impact the scrotal temperature and, in fact, the sperm. So, typically, you want to wait like 70 to 90 days. So, when it comes to interventions, too, it's like you might want to take interventions for at least 60 to 90 days to help with the sperm cycle to get that mature ejaculate.
Right. And other damage that can happen, testicular damage, could be, motor vehicle accidents. It could be cancer. It could be hernias, or varicoceles, which is basically varicose veins in the testicles. And it can increase like congestion and reactive oxygen species or oxidative stress because of that poor circulation. So definitely if, I think it gets missed a lot. So if you feel like swelling or tenderness or just a ropey feeling around the testicle area when you are showering, definitely have that examined, not just for fertility, but also for testosterone production, because it tanks again if you don't get that addressed.
And the other thing that can damage testicular function would be STIs, previous STIs, and sometimes it's not even detected. So, bottom line is like it's really good idea to test everything out, go to the doctor. And by the way, we talk about women and the aging, and we all worry about we're aging out. But for men, there is actually advanced paternal age factor, and that is a reality. But it happens at a little later age. So 45 versus 35 for women, but it's a reality. So another thing that can impact sperm quality will be exposure to chemicals, whether it's inhaling it or contacting it. So sometimes people's jobs, they're actually exposed, but in our environment, there's a lot of that is readily available. So it's a matter of like using the right products, more natural products, and staying away from pollutants as much as possible. Because again, sperm are tiny, so they can be that has that disposition.
Yeah. If you're a painter or you're a car mechanic, finding strategies, by opening the doors or using oxygen, if it's like really high chemical loads, there's definitely strategies around it, which would be good for your overall health too.
And so, just to end things off, because we want this short and tight, there are antioxidants that you may take. So, you can speak to someone like Tanya, call her at aliveholistic.health.ca. You can go through our show notes, myfertology.com. We're going to list everything out. And also, acupuncture has been shown to increase sperm volume and count, not so much in the way of morphology, but we've seen it help. So, check all that out, and we shall see you
Best
soon.
nutrition tips, I would say
Yes.
too. Best nutrition tips would be to follow the Mediterranean diet and um, choose healthy carbohydrates over the milled, refined kinds, and cut sugar. Because type 2 diabetes, there's an epidemic of that, or prediabetes, and high insulin can reduce testosterone in men and increase the risk for erectile dysfunction and even issues with ejaculation. So hormone issues from sugars is a big deal. So change up your nutrition. You'll feel better too. And besides Mediterranean style way of eating, just think whole foods over junk food. Just put in some extra effort to feel good and have nutritious and delicious foods. Those will be very rich in antioxidants. And then, the top 3 antioxidants that I would suggest would be similar to women, like CoQ10 and ubiquinol, considering N-acetylcysteine, And then I would say, like a multivitamin mineral. There are other ones like acetyl-L-carnitine, but it would be more of on an individualized basis. But just speak to a naturopathic doctor or your fertility specialist to get more customized advice. But you can do a lot through nutrition and supplementation in addition
Absolutely.
to acupuncture.
Yeah, absolutely. So I talk about this in my book, Pathways to Pregnancy. I devoted a whole chapter on that. So go check that out on Amazon or on Audible. And this concludes our show for today. So if you like this and you want more information, come to us at myfertology.com. Share this post and with your friends and review it. And we shall see you next time.